Evaluation effect of inhalable particulate matter exposure on human health in center of Karbala city. Abstract: recently inhalable particulate matter PM2.5 and PM10 acquired great interest because of its reverse impact on human health, and its pollution caused inevitable economic losses for society. This study tried to evaluate hourly and daily means of particulate matter, PM2.5 and PM10, concentrations risk in the center of Karbala city in central of Iraq, from June 1 to July 20, 2015. These concentrations crossed two permissible limits at ratios of 16% and 12% for PM2.5 and PM10 respectively. According to health risk assessment, this place outed of hazard risk represented by hazard quotient HQ1 for all days, also save for carcinogenic impact, all days had cancer risk CR 10 to 6. This study approved that the proportions of attributable fractions AF and excessing risk ER, long-term exposure to PM2.5, for lung cancer mortality and cardiopulmonary mortality might decreasing at about 19%, 27%, 23%, and 36% respectively at 95% confidence interval if the concentrations of PM2.5 kept at 3G/M3. Finally, Air Quality Index categorized the ambient air of this place at rating B, good. Keywords: air pollution, inhalable, attributable fractions, excess risk, air quality index. 1. Introduction. Air pollutants categorized as gaseous or particulate matter, BRI et 2000. Pollutants classified also according to the type of formation into primary and secondary pollutants. Primary pollutants released into the atmosphere directly from multiple sources, such as wood burning or vehicle exhaust, GOTS et 2017. Secondary pollutants already presented in the atmosphere and formed from the reactions of pollutants with each other in the presence of sunlight, Barn et al. 2011. Air pollution poses a clear threat to public health, and the huge increasing in population, vehicles, industrial activities, and rapid economic growth had caused a noticeable increase in air pollutants concentrations. The World Health Organization, who confirmed in its report published in 2013 that the number of deaths reached 2 million cases due to ambient air pollution, according to epidemiological studies. Exposure to polluted air causes either short-term, acute, up to 24 hours, and long-term, chronic, months or years, effects on humans, Morakinho et al. 2018. Among all air pollutants, many toxicological studies had shown that particulate matter were the most effective pollutants entering the human body. Particulate matter had a wide range of sizes. It was not a single pollutant. Also, it was different in shape and chemical composition, containing organic, inorganic, metallic, and silicate compounds. It caused many diseases of the respiratory system, lungs, and heart. Continuous exposure to particulate matter leads to death. PM10, particles of diameter equals 10 m, Filonkik et al. 2016, deposited on the surface of the larger airways of the upper region of the lung. PM2.5, particles of diameter equals 2.5 m, deposited on the deeper surface of the lung depending on particle size. Jeffrey et al. 1997. There is a positive relation between exposure to daily mean concentrations of PM10 and the incidence of respiratory symptoms. When PM10 60 G/M3 in cases of chronic respiratory or cardiovascular diseases, Villamizar et al. 2012. Because of the increased risks of pollution on human health, especially in urban areas, health risk assessment needed to estimate the relationship between the duration of exposure to these pollutants and their reverse health effects. These pollutants can directly affect on human health in hot weather because increasing in temperature degree causes extra stress on human body, as recorded in physiology studies. Su et al. 2014. This paper adopted health risk assessment related with exposure to inhalable particulate matter, PM2.5 and PM10, in summer in center of Karbala city, resulting from the increasing of pilgrims from inside and outside of Iraq to visit the holy shrines there. Attributable fraction and excess risk also estimated to decrease the proportion of mortality by avoided the excessive exposure to inhalable particulate matter. 2. Methodology and materials. 2.1 Study area and population. Karbala city located in middle of Iraq, at about 97 kilometers southwest of Baghdad, and a few miles east of Razaza Lake. Karbala had an estimated population of 1,378,000 people in 2013. This city considered a holy city for Muslims because of the location of shrines of Imam Hussein ibn Ali and Abbas ibn Ali, peace be upon them. Twice a year millions of Muslims visited the site, in the 10th day of the Muharram month, Hussein's martyrdom, and the main event is the 40th day. Most of the pilgrims traveled on foot from all around Iraq and other countries. Karbala had a desert hot climate, hot, long, dry summer and mild winter. Between November and April all of the yearly precipitation occurred, anyway no any wet month, https://arwikipedia.org/wiki/. Fig.1 showed study site. Hourly particulate matter PM2.5 and PM10 concentrations in center of Karbala city collected from Karbala Environment Department. These concentrations were done using Air Equal M60 New Zealand origin. 2.2 Exposure and risk analysis. Exposure to particulate matter PM2.5 and PM10 caused carcinogens and non-carcinogens diseases. The effects of exposure evaluated by following the standard methods used in many previous studies, ID equals CIRET at EFAT *BW1. ID inhalation dose, G/kg/day, C particulate matter concentration, G/m3, IR rate of inhalation, M3.day 1, 14.25 M3.day 1 took averaging rate of inhalation for adult male and female, ET exposure time, HR/day, 24 HR/day, ED exposure duration, year, 70 year, F exposure frequency, day/year, 365 day/year, at average time, day, 8,760 day for non-carcinogens impact and 25,550 day for cancer risk, and BW average body weight, kg, 62.8 kilograms, Habibola et al., 2015. 2.2.3 Relative risk. In relative risk analysis, environmental burden disease method was adopted with attributable fractions AF that evaluated deaths proportion which increasing from diseases such as lung cancer, cardiopulmonary and mortality. When particulate matter concentrations eliminated to 10 g/m34, PM10, and 3 g/m34, PM2.5, attributable fractions proportion decreased, Adicanal, 2020. Relative risk RR also estimated the probability of all-cause mortality, or lung cancer and cardiopulmonary mortality, in human exposed to more than 10 g/m3 of PM10. Relative risk calculations divided into two categories. 3. Analytical results and discussion. 3.1 Ambient Air Standards and Air Quality Index. Table. 1 showed the statistical indices of the particulate matter, PM2.5, and PM10, in addition to WHO standards for mean daily data. Figs. 2 and 3 explain the hourly and daily means concentrations of particulate matter PM2.5 and PM10 receptivity. 16% of daily means PM2.5 concentrations and 12% of daily means PM10 concentrations are out of WHO standards. 3.2 Health risk indices. Health risk analysis associated with carcinogenic and non-carcinogenic indices which described reverse effect of inhalable particulate matter on human health. First, the chronic daily intake ID was calculated for PM2.5 and PM10, and the hazard quotient HQ values were determined for PM10 only, no determined value of RFD for PM2.5. From Fig. 4 it is clear that all the calculated values are less than 1 and this means no hazard risk. 4 Conclusions. This paper was concerning with the airborne concentration of PM2.5 and PM10 in center of Karbala city to assess health risk related with exposure to these particles. Health assessment used to evaluate this impact on human health. Results showed that this place had rating B, good, according to Air Quality Index AQI. Hazard quotient was less than 1 in all days and the place is safe for carcinogenic impact. Generally, the proportions of attributable fractions AF and excessing risk ER for lung cancer mortality and cardiopulmonary mortality for long-term exposed to PM2.5 might decreasing at about 19%, 27%, 23%, and 36% respectively at 95% confidence interval if the concentrations of PM2.5 kept at 3G/M3. For PM10 no noticeable effect exhibited.